Our next speaker is going to be online, Dr. Mamadou Alpha Diallo. And I know him as Alpha. He wears many hats. I was looking up your CV, Alpha, and there was more on there than I even realized. He is a senior lecturer at the Cheikh Anta Diop University in Dakar. He's a diagnostic technical advisor for PMI Reach. He's also a senior project coordinator at CGAS, which is the International Center for Research Training in Applied Genomics and Health Surveillance in Dakar. And today, I think he's going to be talking about something that isn't even related to any of those, but very informed by those. So I'm very impressed, Alpha. He's going to be telling us about innovative ways to use AI in disease control. Take it away, Alpha.
Thank you so much, Josh. Thank you, everyone. And sorry for not being present there due to, minor injury. So my talk will be on how we can use AI for infectious disease control in Africa. As you mentioned before, I'm not an AI specialist, but as an end user, we are trying to see how the potential of AI can be used for people working on the public health, as data analysis, epidemiology, and something like this. So as we know, infectious disease is part of a huge problem in Africa, and so that we need innovative strategy for prevention and control. And so that we thought about AI, how can we use AI powered transformation using AI tool like ChatGPT to transform infectious disease strategy in Africa. So the initial focus of this project was to utilize AI, specifically ChatGPT, for data analysis. And the idea was to use malaria as a pilot, to provide evidence-based strategy for malaria. And if this work, and then the idea is to extend to other infectious diseases like TB, HIV, neglected tropical disease, and other poverty-related diseases. So the primary outcome of the project was how can we use AI to enhance decision-making? In other how can we using AI to go faster, but being accurate and inclusive? Okay. Also, to how can we use AI to strengthen healthcare system, right? So meaning if you have a AI tool, how can you integrate it to provide actionable information for healthcare workers and policymakers? Also, how can we use AI to reduce disease burden, in Africa? And by the way, how can you optimize resource allocation? And also, how can we use AI for more equity and for access? For instance, someone working in a remote area, they don't have a medical doctor, they don't have nurses. How can we use AI in this case to, balance and then have more equity and more access and for those vulnerable population? Okay, so we started with collecting the data, because the idea is collect different kind of source of data: epidemiological data, parasitological data, entomological data, environmental, social, and even literature, open source data. We have a large amount of data and sometimes very complex to analyze. So the idea is how we can use AI to analyze those complex data, okay, to give sense of those data, and at the same time, or similarly, to feed those data to train models and to give a sense of those data. So because this was a pilot study, so we choose two sites in Senegal. It's Diourbel and Kédougou, where we decided to collect the data, because these two sites have different epidemiological profiles of malaria. And then at the beginning of the project, we used ChatGPT because this was the call for application. It was specifically how can we use ChatGPT to, to make possible analyzing large complex data. But at the same time, we thought, how can we customize using API, for instance, to make more, focus on our own question, research question or strategy question that we can answer by ourselves. But we don't use only ChatGPT. Our team is also working on other models like Llama 3, because we have technical staff here that is working on that part. Even though we are using the AI as end user, not necessarily as specialists of coding or writing script, everything, but we have a team here who is the subcontract who is working on that part. So as you can see here, this is the personnel that is working on this project. We have a project coordinator, research analyst who is responsible for data collection analysis. We have also a data scientist, who is working on the data set, performing the data analysis. We have a technical specialist, and we have also a communication coordinator who is responsible for developing and implementing communication strategies. So as I said earlier, we have a subcontract. These are the technical people who are working on, to provide technical expertise in the use of ChatGPT and other AI technology. And they also support on the data analysis and interpretation to assist in the data collection, analysis, and interpretation using AI tools. They also help support on the model training, validation, and also on the study design for evaluation of these AI tools on the ground. So these are some examples of how we could use AI for, analyzing data. When we just started the project, there was not at this time the possibility to upload, for instance, a file on ChatGPT. And at this time, what we did was copying, for instance, for PDF, and then asking the model some specific question, for instance, to give you a summary, and then we ask the specialist, like the program manager, are you comfortable with what the AI is telling here? And then he is the gold standard to compare if it's accurate or if it's relevant the way he presents. And this is another example, also using Excel file where you have many numbers, and sometimes you get lost. And then, so say copy those large amount of data and then pass to the prompt, and then ask the model to give you a means of that data. And then also, as I said earlier, to ask the specialist if they are comfortable with the summary. So with time going, and then we thought about, since it was possible to upload image and something like this, because we have many of our data that are collected in the register. So how can we use this tool to extract the data and to go faster? The challenge was the way medical doctor write, sometimes challenging. But what we figured out was if you give context, it can understand and then give you very accurate extraction. And then we are working also on that part. And I think it's a good opportunity, especially for when working on project where you have to use a written file, and then to transcribe digitalize, those data. And we are taking that opportunity to try to see if it's possible to go to the field and then take picture and then extract those data and to go fast. The other component is the data analysis. Here also we are looking if this can help to analyze data for people who are not necessarily specialists. And we compared, for instance, here we have codes that are written by specialists, like the one written here by CDC staff to do the Kaplan-Meier survival analysis, and then to see if the AI can reproduce and how accurate is it in reproducing these code and making the graph for people and to do the interpretation and report writing at the end. So far these are the main topic that we are working on. But the next step also is to go further and to go beyond, and working with medical doctor to see how can we use, for instance, in telemedicine, when you have a technical person who can provide a cliche of X-ray video, and then maybe to have an initial screening for like TB. And the idea is to give many image and then to see how accurate is the model to tells you if it's TB or not in terms of screening. And we are also planning to work with dermatologists to see how this AI can help in identifying some skin lesion. What we noticed was most of those are trained using white skin, and then the idea is how can we fine tune for that skin for some lesion, also for diagnosing of fungal infection that is very common here in Africa. Same thing also for leishmaniasis, which is an NTD, neglected tropical disease. So how can we provide image and then ask the model to predict it? But we have some challenges. It's not always 100% accurate because sometimes it make error and mistake. So I gave an example here where we was calculating some, sensitivity for a test. If you take a look, when we did the calculation using the AI, the confidence interval was correct, but the value for the confidence interval was not correct. So we still need expert to validate. So human expertise is still required, and also we need collaborative approach for efficiency. And the question that comes often when we talk about this project is people, they say, okay, do you want to take my job? Especially medical doctors, epidemiologists, or data analysts. And then we said the answer is no, AI is not here to replace, but to assist. Especially, for instance, we can use it for screening support to help doctors, especially when they have many patients, and to prioritize and manage those patients. And also, like for telemedicine, to provide support in area where you don't have a specialist. And for public health, the main idea is for faster decision making, because sometimes what will happen is the time when you collect the data and the time when you take decision is too late. So how can we use it to streamline the process for data collection, report generation, for quicker informed decisions? So I cannot end without thanking these partners who support me personally, also supporting this project. Thank you.
Thank you, Alpha. We have time for one or two questions. I can start with one. Alpha, it sounds like you were talking to clinical workers at different levels as you were doing this exploration. I'm curious, from that experience of interviewing them, what do you feel like is the next step beyond these explorations to make these tools feel usable, feel like something that they would want to use in their everyday work?
Yeah, I mean, the next step is to validate before, because we need more insights and, having more confidence on the tool. And then also at the same time, convince them, telling them, okay, this is for you guys, this is for to assist you, because you have some areas where you don't have medical doctor, you don't have nurses, and, or you have nurses, but they don't have the required expertise on some aspects. And how can we, if the tool can be useful, at least for screening some aspect, and then take decision quickly, and then coordinate at the central level when they have some issues with some specific diseases that they don't handle. But as I said, for now, we are working on the validation aspect, for not only for medical doctors, but also for program manager, because the example of malaria is where when you have those data, you need to do report, and then most of the time, they take time to generate, to put together all the data, to do the analysis, to do the report. And yeah, again, the idea is how can we go faster, but at the same time to be accurate.
Thank you, Alpha. Any other questions from the audience?
Thank you. Can you comment on data protection? I know that depending on what license you have with OpenAI's model, then you they will agree not to use the data for training, but you're still submitting it. So I wonder how that sort of fits outside of sort of research, where you maybe don't have consent processes.
Oh, yeah, it's a good question, because people here, they are working on that. I attended a workshop because it's something new. It's the Academy of Science in Senegal. They are working on the regulatory aspect of that, because, as many other countries, there is no regulatory aspect on that. And yeah, for sure, we will work with those people. And then, if there is some aspect that are in the regulatory aspect, so we need to be in line with that aspect.
Thank you, Alpha. Let's thank Alpha one more time. Yeah, sorry.